Hey everybody, my name is Paul Barrett. I'm the owner of the Modern Medicare Agency, and I wanted to do a presentation for you guys out there that are new to Medicare, turning 65, 66, 67, leaving work, tiring, all that good stuff. Because I've been doing this since 2007, and I know that Medicare can be a little overwhelming. A lot of my clients tell me on a regular basis that Medicare and Social Security should have classes, there should be people you can go to. Well, there are people that have answers. I'm one of them. I'm a Medicare agent. I specialize in Medicare and have since 2007. So, without going on too long about that, let's get started, guys. We're going to do some Medicare 101. Make sure you understand your Medicare options. All right, so let's start with who's eligible. Well, typically, we know that people that are turning 65 are eligible. That's a trigger. What's a trigger? Basically, it's something that initializes your eligibility for Medicare, right? So you're allowed to enroll in Medicare when you turn 65. You're allowed to enroll in Medicare if, God forbid, you're disabled for 24 months or more. All right. I know a lot of people that go out on disability struggle sometimes with insurance, and I get phone calls 8 months in, 12 months in, 14 months in. You have to wait a full 24 months unless you have some kind of severe illness like end stage renal disease or perhaps Lou Gehrig's ALS. All right. And you also have to be qualified for residency. What does that mean? Well, you need to live in the United States, you need to be a US citizen or a permanent resident for at least 5 consecutive years. All right. So that's that as far as ways to become eligible. Now let's look at enrollment. Everybody always gets confused about how to enroll. They think, let's go to Medicare's website and enroll in our original Medicare. That's not how it works. Since the beginning of time with Medicare, Social Security has always administered the application for Medicare. And it's pretty much because they were both triggered at the same time back in the day, right? You used to get 100% of your Social Security benefits when you turned 65, and you used to be able to be on Medicare when you turned 65. So Social Security was doing the application for Medicare because they're the ones that are taking the money. You're going to take your money right out of your Social Security check to pay for your Medicare Part B. Now, a lot of us are waiting until we're 66, 67 a lot, so on and so forth, even somewhere up to 70 before we decide to become eligible for Medicare due to the fact that we want our Social Security checks to grow. So if you do enroll at 65 in Social Security, you're going to be automatically enrolled into Medicare and you'll get your card. If you wait, then it's an opt-in program. That means you have to take a step. You have to either go online to the Social Security website, which you see on the screen, or you can call the Social Security office to set up a phone appointment. This way they can take your application via the phone. Lastly, my least favorite option, going into the Social Security office personally. If you do that, most of the time you're going to need an appointment. So don't just walk in there and expect to get your application in. A lot of times, depending on where you live, they can be quite busy at times, these offices. So we can either what? Go online, Social Security website, which is right there on the screen, ssa.gov. Make sure it says official government site when you get there. Call the 1-800 number on the screen or visit your local office. All right, so we're getting to the Medicare basics now. What are they? Very simple. Medicare has two parts, right? It has Original Medicare Part A, Original Medicare Part B. That's really what Medicare is. Hospital coverage, medical coverage. All right, when you look down below, you're going to have options for additional coverage. Why do we want options for additional coverage? Well, quite frankly, Original Medicare is not bad, but it doesn't cover everything, and there's no maximum out of pocket on it. So what does that mean? It means that the 80/20 coinsurance that Original Medicare has in place, you can pay 20% of $10,000, $100,000, $250,000, depending on your medical bills. It goes on forever. Every other health insurance plan you've had in your entire life has a cap, a maximum out of pocket, which protects you from spending over a certain amount. I believe in 2025, the most you could spend out of pocket is about $9,300 on any health insurance plan, unless you go out of network. Okay, so there's a big difference between being capped at 9,300 and not having a cap at all. All right, that's number one. So when you look on the screen, you see Medicare supplement over to the left. Next to it, you see prescription drug plan or Part D. These are the ways you're going to complete your coverage, right? Because hospital Part A, medical Part B, they have 20% coinsurance. They also have deductibles involved in them, and they don't cover prescription drugs. So one way to complete your coverage, right, because we're all used to having hospital, medical, and prescription coverage together, would be to get Original Medicare with a Medicare supplement and a Part D drug plan. The other thing you see over here on the screen, or you can get what we call Medicare Advantage plan, or Part C. Everything, as you notice with Medicare, has multiple names. Maybe it's to keep you confused. I don't know. But Part C and Medicare Advantage are the same. And on the other side, Medicare Supplement, you'll also be told that you should get a Medigap plan. And that could confuse you. Medigap and Medicare Supplement are also the same thing. So these are your options. All right, let's talk about Original Medicare Part A. Original Medicare Part A is the inpatient coverage. You see here on the screen, you got a few checks here. This isn't all the things it covers, but these are the main things. You're talking about inpatient hospital, skilled nursing facility, hospice care, limited home health care, pretty much anything that's going to revolve around an inpatient stay, you're looking at hospital coverage Part A. All right, so what are the costs? So typically, most of us don't pay anything for our Part A premium because we've worked either 10 years or more in our lives, which is 40 quarters, or we're married to somebody that did, and we can qualify from our spouse as well. But let's just say you hadn't, and you only worked 30 quarters. You can see on the screen, $285 a month premium. Very expensive. Uh, if you're eligible for Medicare Part A and you worked less than 30, it's a whopping $518 a monthly premium. So we don't want that. Uh, Many people will find ways to continue working to fill those quarters when they see stuff like that. But that's what we're looking at. So typically, 90% of or more are going to pay zero. And then there's a few people that do get stuck, not having it free, and they pay either 285 or $518. Right? Remember, you can qualify through your spouse, even if you never worked. Medicare Part B, the other part of Original Medicare, that's the outpatient side. Doctor visits, outpatient surgery, preventative services, diagnostic screenings like what? CAT scans, PET scans, MRIs, lab work, all that fun stuff. Emergency care, could be urgent care either. Durable medical equipment. That list is way longer than Hospital Part A. We're not going to go through every single thing. Basically, think of it this way: if it's medically necessary, not if you think it's necessary, but if it's medically necessary and Medicare agrees that it's medically necessary, it's covered. Most things will be covered. All right, so Part B costs a little bit different. There is a premium associated with Part B. It's $185. Depending on your income, it may be higher. We have a little sliding scale, and it starts at 106,000. Once, if you're an individual, at 106,000, or a couple at 212,000, filing joint, you're going to see what they call an income-related adjustment. The more money you make, the higher that income-related adjustment goes. So it's important, if you're around those incomes and you're not sure how that's all going to work, you could reach out to us. I'm going to give you my contact information at the end. You can email me, you can call me, you can do whatever, but I'll make sure you get the right information. This way, and you can talk to your accountant and see if maybe there's some wiggle room of things you can do when you're getting ready to get on Medicare to avoid some of that extra income-related adjustment. So Part B, late enrollment penalty. Most people always call me about their late enrollment penalty. I have so many people these days, like I said, that are working way past 65 because they want to get full benefits with their Social Security. So they work past it, but they're worried because somebody at work told them, oh, you got to sign up for Medicare. Sign up for it now. If you don't sign up, you're going to get a late enrollment penalty. You might. Most of the time, you probably won't. Why? Because typically, if you have credible coverage, meaning something that's as good as Medicare or better, and you're participating with a group that has more than 20 people in it, then you don't have to sign up. You could work as long as you want, and you'll have a special election when you're ready to retire. All right. But let's say you do end up missing that enrollment period. As you can see, you're going to have 10% of a penalty of the cost of your premium, 185, 10% of that for each 12-month period that you miss. Now, not happening to a lot of people, but it does happen to more than you think. There's a decent amount of companies out there that I've spoken with recently that their employer has awesome coverage. There's only 10 or 15 people employed there, and this guy's great. He loves his employees. He gives everybody awesome benefits, and even himself, he doesn't realize. I'm using this example without giving names, but I have 3 groups in the last 2 years that this has happened with, where people just don't realize that they need to have Medicare at the right time. So they contact me years after they were supposed to enroll, and they had this great health insurance with a small group of about 10 to 15 people. And when that happens, you have a 30% penalty, 10% for each 12 months, and you can't get rid of it. Ignorance is no defense, guys. They're not going to let you off. And also, that penalty's for life. So you're going to pay 30% extra every single time you pay Part B for the rest of your life. All right. Of course, if you do have a special enrollment period for some reason, then you might be able to get out of it. But special enrollment periods, maybe you moved, you're out of the country, you're incarcerated, you're still working, and you actually have good group health coverage and you have more than 20 employees, then you can avoid those penalties. But for the most part, there's not many other special election periods that are going to help you avoid the penalty. All right, so original Medicare doesn't cover quite a few things, right? This is why we look into getting additional coverage. Deductibles. Part A has a deductible, Part B has a deductible. Copays and co-insurance, right? There's an 80-20 split. Medicare always pays 80% of most things. That leaves 20% co-insurance. 20%, it's not going to pick up. That's on you. You need to pay that. All right. Outpatient prescription drugs. There is absolutely zero coverage for outpatient prescription drugs. That's why we have the Part D program. Part D is also an opt-in program, which means what? You have to sign up for it. You have to take action. It doesn't just come to you. The only way you're going to get Part D given to you is if you qualify for extra help or some sort of Medicaid, and then they'll just give you a Part D plan. Everybody else is not going to get that, though. And that's probably 93% of the people in the country are not going to have a Part D plan given to them. All right. Healthcare outside the US, absolutely not. They're not going to cover you. You can get extra plans like a Medicare Advantage plan that has coverage outside. You can have a Medicare supplement that gives you some coverage. And of course, travel insurance. I always recommend that. That's probably the best way to go for those types of situations. Hearing aids, exams and screenings. That's right. They don't care if you go deaf. Doesn't matter. They don't consider that medically necessary to hear what I'm saying right now. Routine eye exams, most glasses. They say most glasses because you can have a particular procedure, cataract surgery, and they can cover a pair of glasses for you. They're probably not going to be the nice Prada glasses or Warby Parkers that you like, but they'll give you a pair of glasses if you had cataract surgery. Routine dental exams, they don't cover routine dental exams. They don't cover extractions. They don't cover fillings. They don't cover crowns. They don't cover root canals. They don't cover any of that stuff, right? So those things are all not covered. Okay, Medicare supplements. Let's talk about them. Medicare supplements, as I said earlier, you can see up on the screen, also known as Medigap, can fill some of the gaps original Medicare doesn't cover. Most of the plans, they're going to cover your hospital deductible. Uh, they're going to cover some co-insurance and some things like that. They can cover co-pays. But the main reason why a lot of folks really like Medigap/Medicare supplement plans is the freedom. Okay, the majority of doctors in the country, over 90%, are going to accept original Medicare. If they accept original Medicare, they're going to accept your Medigap plan or Medicare supplement plan. So it gives you a lot of freedom. No prior authorizations, no referrals, freedom. People like that. All right. So that goes for hospitals as well. I don't know of any hospitals currently that don't accept Medicare. So that's another reason. People like to have the most choices. That's a Medicare supplement. Standardized plan letter with associated services. What does that mean? Okay, so standardized means same. So they have 10 standardized plans, A through N. And if you have plan A or plan N, and you're looking to compare it with a company, all the companies that are offering plan A offer what? Standardized plan A, same exact benefits. So if you have United Healthcare, you have Aetna, you have Cigna, all three of them have what? The same exact benefits. There's no difference whatsoever. The difference, the name on the card, the color of the card, and the price. Those are the main differences. Then you look at other things like rate stability. How often do they have rate increases? What are their average rate increases? I also like to look at financial stability and customer service. But we're comparing apples to apples when we're comparing Medigap plans. All right, just keep that in mind. Nobody has a better plan N than anybody else. Thing that is better may be the price. That's about it. All right, and just like it says at the bottom, monthly costs will vary by insurance company. You can see 30 plans in a county, and you'll see 30 different prices. Some might be super cheap, and some might be super high, and you're wondering, scratching your head, thinking, why can one be almost double the price? Don't bother hurting yourself thinking about it. Just understand that there's no way you should get the one that's double the price. There's no way. All right. It never works out that way. There's always a nice A-rated name brand carrier that you could find that's going to be somewhere in the top 3 plans anywhere you're going to look. All right. Medicare supplements don't cover what? prescription drugs. They used to many moons ago, but not anymore, right? So you want to make sure if you're going to enroll in original Medicare and a supplement that you also look at prescription drug coverage. Now, do you have to get prescription drug coverage? No, it's not a law. But if you don't opt in when you're supposed to initially, you'll be assessed a penalty, and we'll get to that slide soon. But the main thing is there's very few times of the year when you can enroll in a Part D drug plan. So when you first get eligible for Medicare, you're allowed to enroll in it. And then also October 15th through December 7th, that's the annual election period, you could also enroll in a Part D drug plan. All right, so Part D prescription drug plans. Speak of the devil. Two types of Part D coverage, right? We have standalone. That's the one you're going to get if you get original Medicare and a supplement. Uh, Typically, you can have a standalone prescription drug plan if you have Part A or Part B or both. Doesn't matter. And some people do have just one part or another, and they need prescription drug coverage. But for the most part, we're going to be getting Part A, Part B, and a drug plan, right? That's the way it typically works. Or you can get your Part D drug coverage through what? A Medicare Advantage plan. The all-inclusive plans, the traditional type of insurance, your HMOs, your PPOs, HMO POS, private fee-for-service, all that fun stuff. Those types of plans, 95% of the time, are going to give you a prescription drug coverage. And one of the things that is nice about a Medicare Advantage plan is they get more money from the government to do what they do, cover you. So they typically offer better prescription drug coverage than most standalone plans. And quite often you can get your drug coverage and health benefits at no additional cost. I mean, you just pay for Part B, your Medicare Advantage plan doesn't cost anything, and your drug plan that comes with it doesn't cost anything. So some people like that. Part D coverage information, it's going to cover some of the prescription drug costs. It could cover all of it if it's a cheapy generic, levothyroxines, your metformins, lisinoprils. There's dozens of drugs you can get absolutely zero cost. And they love when you get those types of drugs. You can get them at a preferred pharmacy for $0. You can get them through mail order at preferred from their preferred choice vendor as well, delivered right to your house at no cost. So no matter what, you're going to have continue to pay your Part B premium if you're getting Part B, right, when that's applicable. And you must live in a planned service area. Why do we put that in there? Because so many people say, well, my aunt, my friend, my mother, my brother, my sister that lives in Florida, Arizona, Texas has this plan, and it's great. And they tell me that it covers this drug that I have also so much better. I want that plan. You can't get it unless you're going to move there. If you want to move to that service area, then you can get it. Every state in the country has its own service area when it comes to Part D. So if you live in a state, that's the service area. All right. Part D late enrollment penalty. I told you there was one. This one's a little bit different. So basically, if you didn't sign up for Part D when you were first eligible and did not have credible coverage, what's credible coverage? Basically, it's a drug plan through either the health exchange, through private insurance, through group insurance, that actually had a drug plan that was just as good or better than Medicare's. That's all. Very simple. How would you know? You can contact the carrier directly to ask them if it is credible or your HR director. The penalty, it's 1%. Doesn't sound like much, but it adds up. 1% of the national base premium. So they're saying in 2025, the national base premium is $36.78. That means you're going to pay 1% for each month that you missed. So the catch here is, let's say you didn't enroll within the first 63 days. So you're now 3 months after that, right? So you got 3 months. So you just think, well, I'll just roll in a Part D plan now, stop the penalty. Well, it doesn't work like that. You're going to have to wait until you have either a special election or the annual election period, one or the other. Typically, there's not a special election period very often for those types of things. But if you missed your enrollment period because maybe there was a natural disaster, like we recently had some crazy fires in California, they're now having mudslides, we've had hurricanes, tornadoes, you name it, lots of bad weather, snowstorms, things like that that may have affected you from being able to get enrolled when you were supposed to. That type of stuff. If you moved, if you lost employment, things like that, maybe you got divorced and you no longer have your spouse's coverage. These are the examples that may be able to give you a special election period. But you can see here, if you're missing for 10 months, your monthly penalty based on that would be $3.70. Nothing crazy. But I've run into quite a few people, including my grandmother. Yes, my grandmother. She didn't like to listen to me. She didn't have Part D for 17 years, then asked me about getting enrolled in it. And when I showed her the penalty, she told me to go scratch. So, anyway, that's grandma. But the point is, it's annoying because it's for life. You don't want to pay an extra $3.70 a month for the rest of your life. It's annoying. And it could be more than that. It could be less than that, depending on what your situation is. The bottom line is, if you know, avoid the penalty. This way you don't have to pay extra. All right, let's look at our prescription drug costs, how they've changed the coverage stages. 2025 is much different. Now, stage one, they say deductible phase. You don't necessarily have to pay the deductible. Remember those generic drugs I told you about? Typically, you have 5 tiers, sometimes 6 with Part D plans. But the cheaper drugs, tiers 1 and 2, those are typically not trigger your deductible. So what does that mean? If you got to go get your levothyroxine, that's $2. You go pay $2, and that's it. Even if levothyroxine costs $4.75, you're still only paying $2. If you have a tier 2 drug that costs $23 and you have no deductible phase on that one, then you're going to pay your copay for that probably like $8 or $10, right? So they're not going to apply the deductible to the cheapy drugs. They want you to take the cheapy drugs to try and encourage you to stay away from the name brand drugs, saves them money, and in return, they're offering you small savings. So in 2024, they showed the range from 0 to 545. Should have had that updated. In 2025, it's $590 is the maximum deductible. And a lot of plans do have a $590 deductible. Now, don't get alarmed. Deductibles aren't always bad. Go to stage 2. You see that you have a max amount of pocket of $2,000. That deductible of $545 in 2024 didn't amount to anything towards that max amount of pocket there for $2,000. But in 2025, the $590 deductible counts towards your deductible. Every dollar you spend towards prescription drugs counts towards that deductible. If you reach $2,000, what does that mean? Your drugs are going to be free for the rest of the year. You may be thinking, well, I don't even spend $50 or $100 on drugs. Well, guess what? It's not a big deal to you. But to a lot of folks out there, there are millions of people that in previous years have spent thousands of dollars, like $7,000 a year on drugs, believe it or not. So those people are absolutely ecstatic and very happy about this. But the bottom line is $2,000 is the most you can pay. Catastrophic stage, there is none really anymore. What is the catastrophic stage? That means once you've reached 2,000, you're paying nothing. Whereas in other years, it used to be a percentage of a drug cost or a copay. So it's gotten so where $2,000 is your cap. It's a very simple explanation. Anything after that is zero. Okay, the coverage gap has been eliminated. Save on drug costs. Well, there's a few different things that are going on. The most common and most well known is the Extra Help program from Medicare, right? You see the link there. You can fill out the application on the Social Security website, the same place where you enroll in your Medicare application, by the way. They have the application right there on that site. They take a look at a pretty deep look at all your assets and all that stuff, money, checking, savings accounts, stocks, bonds, all that stuff. Anything that's reportable income, they're looking at, and they're going to based on your income, whether or not you qualify. What doesn't count? Everything on the right. You can have a home, you can own a car, you can have a burial plot, you can see furniture, all that stuff, household, personal items, doesn't count. But anything money that's reported to the government is going to be counted. Also, some states may have a state pharmaceutical assistance program. I think there's about 12 states left that have them. There used to be more. New York State in particular has the New York State EPIC program. It's a wonderful program. They can help you out. They have higher income levels to help people that make a little bit more money but still need help with their drug costs. So if you live in New York, that's a great program to look into. So Part C, Medicare Advantage, one and the same. What's it going to do? It's going to bring everything together like a traditional health insurance, like every other insurance plan you've had your whole life. Medical, prescription, all together, right? So you got hospital, medical, prescription drug. You must continue to pay your Part B premium when you participate in a Medicare Advantage plan, with few exceptions. Some people that qualify for Medicaid will have their Part B paid for by Medicaid. Everybody else, we're going to pay our Part B premium. Now, the good news is a lot of Medicare Advantage plans, close to 70% of them, have zero premium. So that means you're just going to pay your Part B premium, and you don't have to pay anything additional. A lot of people like that. It's attractive. You don't have to pay for your drug plan if you have a zero premium plan, right? So that's included. So you're saving money there as well. And remember, I told you most Medicare Advantage plans do provide better offerings when it comes to Part D. Why? Because they get more money. It's one of the ways they can attract you to not get a Medicare supplement plan because you're saving money on your drugs, you're saving money on premium, etc. All right, dual eligible special needs plans. This is for people that have both Medicare and Medicaid, and there's a few different qualifications. When you have your Medicare and Medicaid type of plans, you're typically getting 100% coverage, meaning you present your card and Medicare pays their portion, Medicaid picks up the rest. Lots of extra benefits, dental, vision, hearing, over the counter benefits, transportation, things like that, all come with that. And keep in mind, with Medicare Advantage plans, depending on where you live, you can have dental, vision, hearing. Most of them have gym memberships, things like that. But when you have the Medicaid plans added into it, they get a lot more extra benefits. They can get money to pay certain bills, they can get debit cards, they get all kinds of over the counter benefits, transportation, and sometimes even money back into a Social Security check, different options like that. So let's look at enrollment periods. Enrollment periods basically are what? When we can enroll in our plans, when we can make changes. The initial enrollment period, it's a 7-month window. And I think 7 months is a pretty large window. This is why they have that penalty set up. And if you don't get involved in it, it's hard to say that you didn't know and things were happening for 7 months. But the 7-month window works exactly like this. 3 months before the month you turn 65, the month you turn 65, and up to 3 months after, right? So you have 7 months total. Special election periods, that's what an SEP is. A lot of people say, oh, you need an SEP. That means special enrollment period. You could be moving, you could be getting divorced, losing spousal coverage, you could be going on to Medicaid, you could be losing Medicaid. There's so many different things. You could have one of those special election periods I mentioned before about catastrophic weather events, fires, all kinds of different things. It's hard to know all of them. That's why if you think that you're trapped in a plan and you really need to switch, it's always good to reach out to an agent, especially one that does Medicare and Medicare only. Those are typically the only guys you're going to find that are up to date on all the special elections. I literally get emailed about special elections probably 10 to 15 times a week. No exaggeration. There's always different ones. Depending on what state you're in, you may have a bunch of them. Some might be ongoing for months and months at a time. During one period here in New York, we had one for gun violence that ran for about 18 months. Pretty crazy. I don't know how gun violence affected a lot of people being able to enroll into their Medicare plan or switch it when they were supposed to, but apparently Governor Hochul thought that it was a big deal. So just letting you know, there could be a special election. So if you think you're trapped in a plan, always ask somebody. Annual election period is the most well-known one after your initial. That's the time of year when you take a look at your plan to see if it's still going to be the right plan for you in the upcoming year. So that's October 15th through December 7th. You can make as many changes as you want every single day from October 15th to December 7th. The last plan that you choose on December 7th that goes in will be the plan that will be yours starting officially on January 1st. This is the time of year where you really want to take a look at everything because a lot of things change with Medicare Advantage plans and Part D plans. Some drugs will get moved from tier 1 to tier 2, tier 2 to tier 3, meaning they're getting more expensive. Copays can go up. Sometimes they go down. Premiums can go up. Sometimes they go down. They might add deductibles to the plan. They might take away the dental coverage that you really like. They might charge a premium for it when they didn't last year. If you don't read about the changes and you don't do anything, then you're going to get stuck the next year with the plan that you didn't want. Nobody likes that, especially with Part D. This is the only time that you can change your Part D drug plan unless what? You have a special election. So just be mindful, all you folks out there, they're going to be Medicare supplement with Part D people. You want to make sure you look at your Part D plan every year. This year was huge for Part D changes. I mean, just tremendous. So many Part D changes out there, and lots of people didn't get their plans changed, and they're miserable about it. It really stinks, but it's kind of on you. Every year, you have to know that you have to take a look at this stuff. They're going to send you a letter with all these changes and something They call an annual notice of change. If you don't understand it, hopefully you have an agent. You call your agent, you ask them about the changes, you go over everything, and they make sure that everything is all hunky dory. All right, so the last one you see there on the screen, that's the open enrollment. It's typically really called the Medicare Advantage open enrollment period, OEP. Runs from January 1st to March 31st. And this is for people that have Medicare Advantage plans that either want to change back to original Medicare, change their Medicare Advantage plan, and that's it. You get one choice. So it's not like the October 15th to December 7th where you can change your mind, pick a different plan, go back, change your mind again. Get one more choice. If you change something in January, it'll start in February. If you change something in February, it'll start in March. If you change something in March, it'll start in April. Get the point? It's always going to start the first of the following month. And that change will be for the rest of the year unless you end up moving or having some other kind of special election again. All right, but those are your general election periods that you have to pay attention to. Uh, that's the other one. So let's say you didn't enroll in Medicare on time. The general election period is also January 1st to March 31st. That's for people that missed their open, or I should say, initial enrollment period for original Medicare. And if you enroll in the general election period, same thing's going to happen, right? If you enroll in original Medicare in January, you'll start in February. If you enroll in February, you'll start in March. You get the point. It used to be where they had the general election people for people that missed their initial enrollment period. If you rolled during January 1st to March 31st, you didn't start until July 1st. So it was a weird thing because they punished you all those extra months without coverage. They don't do that anymore. So just be mindful and make sure you know your enrollment periods. If you don't understand the enrollment periods, I get it. We just went over all kinds of different things here. Make sure you ask questions. Always ask questions. Find somebody that you like, that you know, in a local agency, and most of the time, you're going to get help that you need. All right, so now, whoops, Medicare supplement enrollment period. This is important, especially for folks that live outside guaranteed issue states, right? So we have 4 guaranteed issue states: New York, Connecticut, Maine, Massachusetts. Those states don't require any underwriting. It's always guaranteed issue, which means you could be dying, you could have cancer, you could have a broken leg filling out the application while you're smoking crack, and they can't deny you. As long as you can fill out the application and pay your premium, you're going to be accepted. All right, it's that simple. Now, if you live in other states and you miss your initial enrollment period, there's medical underwriting. So this is why this 6-month window here is very important for a lot of folks. So once you enroll in Medicare, you turn 65 or 6 months from your Part B, whichever one is later, that's your window. Make sure you get yourself, if you want a supplement, get it during that time. So much easier, instant issue, no problems, no rate increases, nothing. All right. You can choose from whatever Medicare supplement plans are offered in your area. Some areas like New York have about 4 or 5 companies that offer plans. And then you go to New Jersey, Pennsylvania, Ohio, wherever, and you can see 35, 40 different companies, right? So it's important to make sure you understand there really is a great deal of stress for folks when they try and get on a Medicare supplement period after they've been on a Medicare Advantage plan and they don't live in a guaranteed issue state. They don't realize that the insurance companies have access to your medical records and they're going to find out. So don't lie on your applications. They're going to find out that you had this, you had that. Doctors take copious notes. All those notes go into records. Those records are all released to these insurance carriers as they're trying to provide insurance to you. All right, so Medicare supplement guaranteed issues, the situations, God forbid, you missed your initial window, you could be moving. That's the number one, loss of coverage. Sometimes, and this year it happened a lot, believe it or not, there was a lot of Medicare Advantage plans that pulled out of the market, meaning they left. They left people without coverage. If that happens to you, you get a guaranteed issue, which means you don't have to answer medical questions and you can jump on board. But moving is typically the number one situation for that. All right, all plan options may not be available. Why do they say that? Because not every company offers all the plans, depending on where you live. There could be a robust market where you have tons and tons of options. But there's a lot of companies that are kind of niche. They try and pick a couple of letters that they want to offer, and they don't want to be the best at all the letters because if you have too many clients, you get too many claims, you're not as profitable. So they pick a lane and they stay in it, so to speak, right? There's companies that love high deductible plan G or high deductible plan F. There's other companies that love Plan G, Plan N, Plan K, and any other letter in between. All right. If you don't qualify for one of those guaranteed issues, once again, I don't know if you guys out there watching have ever filled out a life insurance application. Uh, the Medicare supplement application is very similar. You're going to have 30 to 40 underwriting questions. Then they contact your doctors and they go through all their due diligence to make sure that you're not too high of a risk for them to approve. So if you don't have guaranteed issue, just know that there's a very good chance if you have pre-existing conditions and take a lot of medications that you may not get your coverage. Star ratings. Each Medicare Advantage plan and prescription drug plan, they're assigned star ratings. Medicare sets this up. They have member satisfaction surveys, performance measurements based on 40 key factors, so they say. You can find all kinds of additional information about this on Medicare.gov. But it is kind of important, a trend that I've seen from doing this 17 years. Uh, Anybody under 3 stars, I definitely stay away from. It happens more with Part D plans I see in our area than Medicare Advantage plans, but there's time from time where I've seen some Medicare Advantage plans getting ready to go out of business. It's typically what it means. When you have two stars or less, you're going out of business. That's just the way it is. Many reasons. One, clients aren't happy. That's one of the main reasons. Number two, providers aren't going to be happy because you're probably not paying them on time. And if you have low star ratings, guess what? You get paid less reimbursement from the government. So it's a terrible way to run your Medicare Advantage or Part D company. So star ratings do play a role. Ideally, you want to see 3.5 to 4 stars. Those are solid plans. Anything above 4 stars, absolutely awesome, great. So you have many options for coverage. Depending on where you live, you can have dozens and dozens of Medicare Advantage plans. You can have, 10 to 15 to 20 Part D plans. There's so many choices. And on top of it, maybe you still want to keep working and you have a company with group insurance with over 20 employees. If the coverage is good and you're not paying too much for it, awesome. Stay on it. Stay on it as long as you can. Enjoy the ride and get on Medicare when you leave. You'll have a special election at any point once you're over 65, whenever you're ready to retire. All right. You can continue if you have a retiree/military plan, if applicable. And the good thing is, too, military benefits, you could also add in a Medicare Advantage plan or any other coverage for that matter and use whichever one suits you best at the time. Why I say that, I have several family members that are retired, and in recent years, they've gotten on Medicare Advantage plans, believe it or not, because their CHAMP VA benefits or whatever, they're not accepted by all the doctors in the area. There's no VA around for them to get to. So it's not always the best coverage because if you can't find a doctor that accepts it, it's really quite pointless that it's 100% or 50% coverage makes no difference, right? If nobody accepts it, nobody accepts it. So remember that if you're a military person, you have the opportunity to have more than one coverage and use the one that best suits you at the time. All right. You can enroll in a Medicare Advantage plan, right? One that absolutely covers prescription drugs, unless for some reason you don't want to because you're a retired vet and you get all your drugs from the VA, or you have some kind of union coverage that supplies you with adequate drug coverage and you don't need it, you can do that too. Enrolling in a Medicare supplement plan and a standalone Part D prescription plan. These are basically your options. One way or another, if you have questions, concerns, all that good stuff, myself, my team, we're always here to help. I highly encourage you to reach out, ask as many questions as possible. All right, during our appointment, when we review your needs, this is what we do for you. We start talking about when is your Medicare going to start? When do you need it to start? Are you still working? What zip code do you live in? Primary care doctors, specialist doctors, medications. These are more questions for people that are getting on a Medicare Advantage plan. Medications is for everybody, but doctors, if your doctor doesn't accept Medicare, there's nothing you can do. There's no way to get it covered, right? So you want to have a doctor that works with Medicare. This way, you're going to have some kind of coverage, whether it's an Advantage plan or a supplement. All right. And if you're looking for a certain service, like some people are very concerned with having hearing aids and hearing services, vision services, dental services. Other people want to have the freedom and have the most doctor choices. Whatever it is, we go over all those things. There's no one size fits all here, guys. I promise you. I don't care what any of your friends tell you. Doing it for a long time. There's no one best plan. I have people that are on the most expensive supplement plans. They still complain about a few things, because they have to get an extra dental plan or vision plan. things like that. There's certain procedures that might not be covered. But, you know, on the hindsight of it, there's Medicare Advantage people that all the time are complaining because their doctor stopped accepting the plan, which can happen. But you know, you can get free dental, free vision, free hearing, free gym memberships at no cost. So budget's always going to factor in. Where you live is going to factor in. Lifestyle's going to factor in. And we talk to you about all those things, and we do our best to help you make an informed decision. As independent agents, that's what we are here. We work with WellCare, Humana, Emblem Health, Health First, United Healthcare, Aetna, Cigna, Blue Cross Blue Shield. I mean, so many companies. Literally, I'm contracted with over 30 companies right now, and I have a team of agents that is as well. We're not here to sell you anything. We're here to help guide you, help you pick the plan that makes the most sense, right? Our business doesn't pay us a lot for having a new client. It pays us decent for having you stay with us for long term. So that's the most important part. Okay. If you guys have any questions, concerns, any of that good stuff, here's all my contact information. I thank you guys so much for watching. If you want, you're welcome to email me, call me. I can send you the slide deck or any other information you need. All right. Thanks again.